So we have Dr. Swarnjit Bhullar. He specializes in pulmonary medicine and he is associated with Crystal Healthcare in Bathinda. Hello, Dr. Swarnjit.
Hello.
It's great to have you on the show with us today.
Thank you.
So, you have spoken about ILD at the MAPICON.
Yes.
But I would like to start with asking you, what are the most common lung problems we have today?
Most common lung problems, like in our practice, especially in our region in Bathinda and around Bathinda, and especially in India also, it is bronchial asthma.
Okay.
So, what we treat is asthma, we say, and Punjabi we say dama. So that is the most common and associated with various causes, especially nowadays with the pollution, increasing air pollution. That is the most common.
Okay. And how can we keep our lungs healthy?
For
our viewers, if you could tell.
To keep our lungs healthy, there are few things that we can do. The most important thing is avoid smoking. Since nowadays with various our culture and other things, the smoking is increasing.
Yeah.
We should avoid smoking. It doesn't help us in it. The smoking is one thing which doesn't have any significant benefit on the human body.
Okay.
There may be some benefit of alcohol, there may be some benefit of opioids, but there are a lot of side effects. Smoking is one thing, there is only side effects, it only damages your body, especially the lungs, and doesn't have any beneficial effect on the body. So most important thing is avoid smoking. Second is pollution. We should try to, like from our side as a society, as a role, we should try to avoid, we keep our cars clean, properly serviced, so that we can avoid, this is an agriculture economy. The city we are sitting in, this is entirely the agriculture economy. So most of us are associated with agriculture also. Most of us have fields and all. So we should always tell our farmers, who are our brothers and sisters, don't burn stubble, especially when the next month the season will start. So that is the thing that we can avoid. So the second most important thing is try to decrease the pollution to whatever possible. That is a thing. And whenever there is a increased air pollution, try to remain indoors, avoid outdoor walking, outdoor activities, and maybe use various protective equipment like masks whenever we require to go out during that polluted environment. These are the at least most important things that we can do to protect our lungs.
Great. That's some really good, insightful information for our viewers. Also, can you give us an overview about ILD?
ILD is a very specific disease where the lungs will start shrinking.
Okay.
So they will start getting fibrous, they will start getting shrunk, and whatever lungs have shrunk, then they will not come back. There is no particular medication available to get back that lungs.
Okay.
So but we can slow the progression, we can slow the disease. So this is a very particular subset of disorders, especially comes when patient who has rheumatoid arthritis, different arthritis, and various other diseases, even with smoking also. So there are almost 100 types of ILDs. The thing is, whenever you see an ILD, if you have to start treatment immediately, because these diseases, if they are gone unchecked or if they are not treated properly, they can really be catastrophic. Their life expectancy may come down. Some people may ultimately go on bed or on deathbed within a few years after labeling ILD if they don't get a proper treatment. But nowadays with proper treatment and evaluation, ILD patient can live as long as a normal person.
Okay.
So that is the beauty of modern pulmonary medicine.
Great. That gives us a lot of information. So any message for the normal public? Anything would you like to say?
So regarding from the pulmonary point of view, these are the 2-3 important things I've already discussed, avoid. We should look for a society, a smoke-free society. That is the important thing. We should be avoiding active as well as passive smoking in our society. That is the most important thing, I think, for the future. Okay. Second is, obviously, I will discuss about the air pollution. So that air pollution is it will damage to yourself also and to your society also. So that is a thing that where we can work upon. These are the, I think, from pulmonary point of view.
Anything you want to say about MAPICON?
MAPICON is a very good initiative by Dr. Atul. It's happening like whenever I've come to Bathinda from the practice, I think it started from the same year, somewhere from the next two, like it's almost 8, 9, 10 years that the MAPICON is happening.
Okay.
And this is the most biggest conference in Bathinda which happen in every year. So it's a big platform to combine lot of very intellectual figures, various physicians who are in their own field to basically collectively to unite at one platform and give their own vision and give their lectures, which helps in to the future generations also.
Okay. Thank you, Dr. Swarnjit. It was a pleasure having you with us today. And thank you for all the information.
Thank you. Thank you to the MAPICON also. Thank you, Dr. Atul also. And thank you to all.
Thank you.